Is that Greg?
Yes, afternoon.
I couldn't find any of my device settings, so I was sitting here in silence. How are you?
Good, how are you?
Oh, I just got back from trying to walk the dog. Uh,
Ooh, yeah.
we got half a block, and then I carried him home for half a block.
Yeah, their little feet can't handle it, right? Even the big dogs can't
Oh,
handle
and he's a big boy, so
it. Aha.
I
Hey, Andre,
yeah, yes,
he's a
we're
big boy.
he is. We're both getting larger
So
these
just so you're
days.
aware, we're live.
Well,
Uh,
Andre still is a big boy.
yes, yep. I'm live and I am not a cat. Isn't that our new sign in? All right. I'm not even part of this meeting. I'm just here to watch. So I'll shut up and let you guys get to business. Nice to see you all.
Yeah. I was just waiting for the printout. No rush in that. Good afternoon, ladies and gentlemen, members of administration, community members watching online, as well possibly on TV. Welcome to the Community Safety Standing Committee. My name is Ryan Parker. As councillor, I'm also the chair of this committee, which is now meeting for the second time. It is a little bit of a learning process, so I just ask for patience, but I know we will get through this in a positive manner. I'd like to first read the reconciliation statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future, while recognizing and respecting their cultural heritage, beliefs, and relationships to the land. The City of Lethbridge is also the home of the Métis Nation of Alberta, Region 3. To my right, I do have our Deputy City Clerk, Mr. David Sarsfield, and we're just going to do a roll call, Mr. Sarsfield, if you could, of the members.
Sure.
As well as supporting administration as well.
So the members of the committee, I'll do a roll call on them first. Councillor Campbell,
I'm here.
Councillor Morrow,
Yes.
Councillor Parker,
Here?
Councillor Higgin.
Aye.
Great, so those are the members. In addition, we have with us Councillor Carlson. We have in addition Robin Harper, who will be did the first submission, and we also have support from city clerks.
And
And Greg Adair, who's the Director of Community Services.
I do believe Councillor Carlson just watching the meeting as well. And anyone, just like any member of council or anyone in the community, have all the right to watch these meetings. These are public meetings, and it's very important that that be noted.
In addition, we do have the lead director of Alberta Public Health, and that's Dr. Vivian Sutor.
Sure. Dr. Stu, are you there? Are you online, and can you hear us? Dr. Vivian Sutorp, are you there?
I I saw her there a minute ago. I don't see her now.
I see her as a guest on my screen.
Okay. No worry, we'll make sure to make a note that she's there.
Short trip.
Is she there? Dr. Vivian Sutorp, are you there? That's okay. As we move along, we'll try to connect with her. But before that, we'll just get into the adoption of the agenda. Do I have a motion? Councillor Higgin, would you I have a following motion signed by Councillor Higgin that the agenda of the Community Safety Standing Committee meeting on February 11, 2021 be adopted as presented. Councillor Deputy Mayor or Acting Mayor Higgin?
Anything? You don't call for the vote.
Okay, all those in favor? Opposed? Okay. I'm going to take most things as consensus unless I hear otherwise opposed, but I will ask if there's anyone opposed. Thank you. I have a following motion signed, I hope it will be signed by Councillor Acting Mayor Higgin on minutes. The minutes of the January 14th, 2021 meeting have been circulated. Are there any changes? If not, we'll just adopt them by consensus. Very good.
No changes, I'll call for the vote.
All those in favor? Perfect. Opposed? Thank you. Members of the committee include myself, Councillor Hagan, Councillor Morrow, Councillor Campbell, and myself, I am the chair. Other members of City Council have been invited to attend. In addition, we have Dr. Sudort online. She is the lead medical officer of health for South Zone with Alberta Health Services. She is attending as a subject matter expert, answering questions only, and I emphasize answering questions only. We also have representation from regulatory services. The purpose of today's meeting is to review the temporary mandatory face coverings bylaw. This bylaw was adopted by City Council on August 24th, 2020. It was deemed to be no longer in effect after December 31st, 2020, unless it was extended by Council resolution. Council did pass a resolution on November 30th extending the bylaw until February 23rd to allow an opportunity for residents to state their view. The committee will consider any submissions we receive and potentially provide recommendations to City Council. They will debate the matter at their February 23rd meeting, which is their next meeting. We will provide anyone who wishes to speak the opportunity. They will be limited to 5 minutes. Please come to the microphone and identify yourself. If you have a written submission, please leave a copy at the presentation table, and we will add it to the published agenda. Between each speaker, we will sanitize the area. Depending on the number of speakers we have, the committee may choose to group them and ask questions of each group. Then dismiss that group as to make room for the next group. We are limited to a total of 19 people in council chambers, and that includes us around this table, as well as members of the administrative team or staff. We would appreciate leaving so we can make room for other people. We will first call upon Robin Harper to provide some background to the masking bylaw. Mr. Harper?
Good afternoon. Can everybody hear me?
Mr. Chair,
Yes, yes.
it's Joe.
Councillor Morrow?
Before we proceed, may I ask some questions, please?
You're sure more than welcome to. And any member can ask questions, of course, that be on this board.
First of all, this is a committee of council. I totally understand it. And what we're going to hear today, I'm assuming will be brought forward and pretty much repeated again at the council meeting?
Not necessarily. So the presenters may unless requested, not be coming to City Council. It's our role to make a recommendation to Council as an SPC. And that was the directive. Mr. Sarsfield, is that how it was taken as well?
Correct. So the purpose of this particular Standing Policy Committee is to allow for public input. So based on that public input, this committee may or may not make a recommendation to Council, which Council may choose to act upon.
Okay, so if this committee chooses not to make a recommendation, what happens?
So
Since the existing bylaw will expire, I think, on the date of our meeting, will it not?
So what will happen is whatever the copy of the submissions that were received, a summary of them will be given to Council with the link, and it will say that there was no recommendation, or it will show that a vote was taken and all the votes failed, whatever the case may be, and then it'd be up to Council to take further action, whatever they may choose to do.
But to answer your question, Councillor Morrow, if we did nothing, if this meeting was canceled and we did nothing no matter what, the masking bylaw would expire on February 23rd. Does that answer your question?
Well, yes and no. Where I'm having the problem, this was a resolution passed by council. It's obviously a very much talked about issue in our community. Quite frankly, as one member of this committee, don't feel comfortable that this particular topic has come to this committee. I believe it should go to council as a whole. And for that reason, I've never done this before, but I would suggest that we somehow postpone this meeting with regrets. If there's people there, I'm sorry. But I think this should be better dealt with in front of 9 members of council, because it's council's. It was council's resolution, and so for the 4 of us to listen and make a recommendation, I personally don't believe that's right.
Okay.
So can that be done? Mr. Firefield.
So the direction from council was that input be allowed at this hearing. That was the direction, the resolution that was passed by city council. So they directed this committee to hear the public input.
Sorry, that resolution was when we created these committees, or was that resolution, when was that resolution?
On
And
November,
what do you,
on November 30th, we passed a resolution, that being council. It wasn't unanimous, but it was passed at the November 30th meeting, that we send this issue to this SPC for us to review and to hear people for and against or recommendations. And then it was up to us to make a recommendation to council on what to do moving forward. So we're doing what was requested of us by city council by having it here in front of us today.
okay, thank you. And I'm sorry I'm not trying to be difficult here, but so I'm assuming we have several members of council here. So really, if we have if we have 5 or more members of council, that creates a quorum of council.
It's only a quorum of council, and I appreciate that, Councilor, and I did ask this question earlier. It's only a quorum if you have 5 members of council that can vote on this. It's only 4 members that are on this board. And I do believe I've been told by Councilor Carlson that he is just like a citizen who's just watching to gather information.
So the members of council that are not on the Standing Policy Committee, they do not count towards quorum and they're not able to vote. They, like any other citizen, are welcome to participate and watch.
Okay, and I know some of you, I'm sorry to drag this on, but this kind of bothers me because we have always been told in the past, even if we 5 members of council were to go out for a beverage after a meeting, that constitutes a quorum. And I know that we've always been told that that is not allowed. So I totally understand that only 4 members of council can vote here. But if there's 5 or 6 or 7 members of council that will contribute to the debate and the conversation, we are technically moving something forward. And we already are we are a quorum because we are members of council. So I have a problem with that.
Do you want to respond?
I'm just, here's the situation. We've had other committees of council where usually we have 3 or 4, and sometimes, for example, the mayor will sit in and listen and all that. So sometimes there's more than 4. But I think, and I appreciate what you're saying, Councilor Morrow. I think the key here is only 4 people can make a decision. And like all council meetings or all committee meetings, they are most often open to the public. And so when a member of council wants to be part of that, I use the word lightly, be part of it. They're just coming there as from an observant perspective. They're not adding to the discussion, or they should probably try not to add to the discussion and swaying and all that. Rather, they're just there to observe. Councillor Hagan?
Thank you, and I appreciate that, Mr. Chair. But that did bring the question to myself that we have been told time and time again, and I know we all know this, that we do not go out for a beverage or for any meeting outside where we're still not making decisions. We're not making decisions there, but having more than 4 definitely.
Mr. Chair, if 2 of your committee don't want me here, I'm gone. I don't have to be here. I was trying to do what I thought was part of my job, but if 2 of you really have a problem with it, even though you voted for the terms of reference that allow it, I can go.
Councillor Carlson, you have all the right to stay and watch.
Yeah, I've got no problem there, Mr. Chair.
And
but
I think at the end of the day, this whole SPC is going to be discussed because here's the thing, and Councillor Carlson, please stay and watch and be informed. And I encourage that. I think we just want to make sure there's a fine line between participation, and I think that's the most important thing. And I think Councillor Carlson knows that as well. Just like any citizen can participate, that's why we're having this here. I think what we struggle with, and this is new to the SBC, and this is a really good conversation, is there's going to be so much information that could be brought forward here, and then maybe don't know how to make a decision, or maybe we may recommend that all these submissions and all these presenters come to council and make a presentation. It may end up being like that. We don't know how this is going to morph. We're all coming here with a beginner's mindset, an open mindset, but it may come to a point when after we hear from everyone, we go through these submissions, people on both sides of it, we may come to the point we don't know what to recommend. But at the same time, if we do recommend something, council, which is made up of 9 individuals, they will make the final decision. Our role as an advisory committee is to make a recommendation to council. Just like we've done that with MPC, when MPC is presented and made, and actually at times we've actually overturned, council has overturned recommendations from MPC. So council has the final say. We're just doing the kind of the work, doing the investigation, coming to our conclusion, but it's up to council to have the final say. So,
and if I may add, in effect, really, these standing policy committees have taken the place of the finance committee and the CIC committees, where all of council were in attendance. And those particular committees, they invited people to attend and to make submissions and that so forth. And ultimately, the decision being made at City Council. This is no different. So in those cases, we had all 9 members of council. They may have made a recommendation, but ultimately it was council made the decision. This is no different.
Mr. Sarsfield, the question I would have about that, if I could, Mr. Chair, is if we were meeting in Finance Committee, for example, and there was only 3, we could still continue that, no problem?
So it depends on what the terms of reference are. So in the case of the Finance Committee, quorum is more than half, which would be if there's 9, there's 5.
Okay, and in this terms of reference, that's why it is different. Because I have listened on YouTube, as Councillor Carlson is doing, to many of the standing policy committees, and to get informed and educated on the topics. And so when they do come to council, I can make a decision. But I still go back to what Councillor Morrow just mentioned, that we just can't gather as a group, and I just wanted to know how this is the difference. But if we don't have an answer for that, I guess we can move on.
Yeah, and really, you're not making any decisions. All you're doing is making potentially a recommendation. And so we are in the trial period. This is probably our first real standing policy committee where we've really had public input. So we just started the standing policy committee. So at the end of the year, if not before, we will do review and take some lessons learned and see what we like and what we don't like. But we are trying it out, so it is a little bit of a trial and error.
Trial basis, but so it is fine for 5 of us to meet together for supper, and that shouldn't be a concern then?
So what we're dealing with is this particular standing policy committee, which has terms of reference, which are included in the procedure bylaw, and they stipulate the quorum is 3 and the membership is 4, and that any other member of council is welcome to participate, but don't count towards quorum or the vote.
Okay, thank you.
Mr. Chair, it's Joe again. I'm sorry. Thank you very much. I'm sorry for bringing it up, but I need to make a couple comments. I definitely do not want Councillor Carlson to leave, or any member of council to leave. Actually, it's the opposite. I'm not whining, as Councillor Carlson stated that I am. What I'm actually doing is I'm actually wanting to involve all members of council, especially when we're talking about an issue as important like this. So I'm actually trying to do the opposite, not remove members from participating. I just have a problem with the whole quorum thing under the Municipal Government Act. That's it. Thank you very much for allowing me to speak and to express my concern, and I'll gladly participate.
Thank you, and don't apologize for anything. It's a good question, some good conversations. I just want to make sure, Dr. Vivian Sudar, I apologize. I apologize if I am doing the name correctly. Are you online? Are you there?
Yes, I am. Can you hear me?
Yes, thank you.
Yes, I am. I had IT to come and help there. I was having challenges with hearing, so I have audio now. Thank you.
Don't worry, we're all done. Thank you very much. No, I'm just joking. We're just starting. So thank you very much for being here, and we know you're here just to answer questions in the capacity and the role that you're in. So we, on behalf of the committee, we appreciate you being here, and thank you for that. I see I have a hand up here.
That's me. Just to make things easier, I'm out of here. I noticed Councillor Kaufman has also joined. You may want to ask him to leave too. Have a good meeting.
I encourage all my colleagues to please watch and be part of it. Okay. So anyway, getting back, everyone on council and anyone in the community is more than welcome to participate in watching this and being part of it in regards to, obviously they're just not in the voting capacity. So I encourage them. And so hopefully they will come back, and hopefully Councillor Kaufman's still there as well. So thank you, Councillor Kaufman, for watching in on. The more members of council to gather information, the better. So getting back to our agenda here, Mr. Robin Harper, you are now on deck.
Okay. Thank you very much, Councillor Parker. Good afternoon, members of the Community Safety Standing Policy Committee. I'm here today to introduce the submission regarding bylaw 6239, which is the temporary mandatory face covering bylaw. As Councillor Parker mentioned previously, City Council approved the bylaw on August 24th, 2020, and extended it on November 30th, 2020 until February 23rd, 21. Administration was instructed at that time to bring this forward to this meeting to allow residents of Lethbridge to provide input on the bylaw. Councillor Parker also introduced Dr. Sutor, Medical Officer of Health for the South Zone, as well as Dave Henley, who is the Senior Bylaw Enforcement Officer with the City of Lethbridge. Mr. Henley is seen firsthand and has responded personally to a lot of calls in regards to the masking bylaw, so he does have a lot of information on that if anybody would like to ask him any questions in that regard. Obviously, this, as was mentioned, there's viewpoints on both sides of this. The point of this submission, again, was to bring forward to allow for discussion. At that time, there was a specific number of cases, both province-wide, zone-wide, and locally. And those numbers that are indicated in the submission are reflective of the time that the submission was put into the system. When it was first introduced in August, call volumes to 311 as well as to bylaw were significant, and they took up a significant amount of time for both 311 and regulatory services. Since that time, the call volumes to both departments has decreased dramatically, and you can see from the graph that I included, the huge spike immediately after it was approved, and then since then it's drastically reduced. Also, some conversations with both regulatory services and LPS have indicated that there are some the way the intent and the way the bylaw is currently being handled, in their opinion, has been effective, and as a result, the recommendation that we have today is just that. It's a recommendation from administration. The date that was put on it was to the end of 2021, December 31st, 2021, and we based it on a couple areas. One, the vaccination program is not expected to be complete until late fall. So that was really what one of the key factors of that date. Again, that's just a recommendation. Obviously, as Councillor Parker pointed out, the decision as far as the direction of the bylaw and any revisions or dates lies with City Council. On December 8th, the provincial government introduced a new health order that mandated the use of masks. That obviously supersedes any municipal mask bylaw, which is in place right now. If that bylaw or if the health order were to be rescinded and changed, and the local municipal bylaw was not extended, obviously there would be no mandatory requirement for anybody to wear a mask in the community. One error I'd like to point out that was in the original submission RFD, on page 2, where it references the numbers of cases, I mistakenly put in active cases in Alberta, the South Zone, and Lethbridge. Anywhere where it says actives, it should read total, and I apologize for that error. So as I mentioned, we presented 3 options. First one is to rescind the bylaw. The second one is to extend the bylaw in its current state and intent until the end of the year. The third option would be to extend the bylaw with revisions until the end of the year. And obviously, we are open to any questions for myself, for Mr. Henley, and Dr. Suto.
Thank you, Mr. Harper. Just a quick question. When you say rescind would only mean if you did it before the 23rd of February, am I correct? Otherwise, it would just expire?
Yes. If nothing was done, as mentioned previously, it would expire and it would no longer be in place.
Okay. Thank you, Mr. Harper. Is there any questions of Mr. Harper? I know Mr. Harper will probably be sticking around for a little bit if we have other questions following up, but since his presentation is fresh in our mind, is there any questions from the committee to Mr. Harper at this time? Councillor Campbell?
Thank you. And I don't know if this is directed to Mr. Harper or not, just in terms of the challenges that are presented to city management in enforcing the bylaw, and I know we don't really enforce it, but what have been some of the biggest challenges when situations have arisen, and compared to when it first was established, and then maybe as of the last little while, how are we doing? How are we dealing with that?
I would defer that to Mr. Henley.
And Mr. Henley is not in the room. Unless he's online. Mr. Henley, you online?
Yes.
Perfect. Thank you.
Well, I'm here. I'm just in the dark.
Did you hear the question?
I did, yeah. So to answer that, I think the initial thing we need to do is we need to take a look at what terminology we're using as far as not enforcing. So enforcement means a variety of things, and included in enforcement is the communication plan, education plans, and education that occurs and directions that are issued. And I'll use directions versus warnings or tickets or anything like that. So certainly the bylaw, since its inception, has followed all of those steps. We've managed every complaint and answered every call and gone to each location and talked to each business owner and persons who had questions. So when you talk about enforcement, all of those steps have occurred with the exception of the actual violation ticket portion of it, right? So you need to put everything in the right kind of context. The challenge that we face certainly is initial significant communication gaps between what was legislated provincially and municipally, right? So it was a municipal bylaw versus provincial regulations, and people simply just didn't understand at the beginning of it. They didn't know how the rules applied to them, how they applied to the business, what was an exemption, what they could do, where they needed to wear them. But over time, that was alleviated, and certainly it changed when the provincial legislation came in place. And there was a significant increase in compliance when that legislation came in place. And I do believe that's because there is now consistency, right? So there's a consistent message from both the city and the province and every other municipality that's got a bylaw as well, right? So that communication has really helped. When it comes to the challenges of trying to, right, enforce this bylaw, first and foremost we have a limited capacity, right? So we have a small staff, and there was a lot of questions to begin with. Now we can manage that, certainly. When it comes to the actual violation ticket portion of it, it's determining whether the offense occurred in relationship to the exemptions that are in place. And the other challenge that we face is, in all honesty, businesses want us to be able to be there to advise them and help support them in their business activities, but they really don't want bylaw officers standing at their front door. Right? They're facing enough struggles as it is. They don't want a bylaw officer standing at their front door being another barrier to accessing their business. Does that answer your question, Councilor?
Yeah. The other, just to follow up, because the provincial bylaw supersedes the regular bylaw in Lethbridge, has that created confusion, or having the provincial bylaw, does that sort of make it clearer for a business owner or when they're dealing with people who are not complying?
So I think to answer that, everything has happened in stages with this bylaw and with the masking regulation, as well as all the other COVID regulations. So there's always going to be an initial concern over communication when the legislation first comes through, and that did occur. So certainly it was businesses phoning saying, how is this impacting our private workspaces now? Because it included workers that couldn't isolate properly, right? So there was lots of questions that way. What it did, however, working in conjunction with our corporate communications group, who did a fantastic job of getting this out and putting signboards at the entrance points to our city, is I believe that it increased compliance after the first couple of weeks. So the two bylaws, both the bylaw and the provincial enactment, they may be worded slightly different, but they're both saying basically the same thing. And they're saying the same thing as far as the exemptions go. So from my perspective, we're in a position now where there's parity between provincial legislation and municipal legislation, and it certainly is alleviating miscommunication rather than creating miscommunication.
Thank you. Mr. Chairman, could I ask Dr. Suttorp a question, if I may, or I can hop out?
No, please do.
Thank you, Dr. Suttorp. Thanks for being with us. I just wondered, over the course of since our bylaw, and when we've seen rises and cases go down, can you make a correlation between why we've had spikes or why we've gone down? Because I know that certain healthcare facilities will have spikes, but can you make any kind of correlations to the variances of the number of cases we have in specifically Lethbridge?
Yeah, thank you for that question. Excellent question. So over this time period, it's difficult to make a correlation between one public health strategy and take it out. We don't do randomized controlled trials where we have disease transmission in a community and some are masked, some are not masked, right? So it's a bucket of strategies: social distancing, hand hygiene, cough etiquette, stay home when you're sick, get tested. Now we're adding the immunization piece. So most of these responses and all sort of infectious disease prevention is a number of strategies. And so it's very difficult to say one strategy works better than another. So that's the one piece. What we have seen is most of transmission is in homes and Dr. Hinshaw, a good friend of mine, she has said this many times, and in homes, at funerals, at parties, or travel where people are in their social circle, if you will, without masking. And that social circle is not even high transmission at schools. If you think how much time kids spend in schools and on buses, et cetera, we do not see a lot of transmission there in general, and not a lot of new cases. We have kids quarantining because of our partnership with our school divisions, but we don't see a lot of transmission. And yes, there's masking in those schools, et cetera, and there are strategies in place. So there's not really one item that stands out to me. I think the immunization piece, as you noted, is a key component as that rolls out. It really truly is that the entirety of all measures.
Thank you, Councillor Parker.
Thank you very much. Acting Mayor Higgin.
Thank you, Mr. Chair. Question for Dr. Suttorp, if I could. Seeing the bylaw that we currently have in Lethbridge, and you obviously know quite well the bylaw, the provincial recommendation currently for masking, do you see that there's anything, how would I ask this, does it not cover what we are currently, our bylaw, our current city bylaw is covering? Do you think that the provincial one pretty much covers all of that?
Yeah, so actually, I was looking at that just prior. I'm like, okay, because as was noted, the provincial regulation supersedes sort of that municipal piece. How long that will be in effect? In effect, I don't know that piece. So in general, mask wearing, again, there are very few exemptions, if any. There is no clear evidence to identify specific populations where a mask can be exempt. So that's a separate piece. But the only difference is the timeline, and I don't know the timeline, how they align. So that answer, that will have to go back to Dr. Hinshaw. Thanks.
Yeah, and thank you. And just to follow up on that, and thank you very much for that answer. So we do have experts and professionals that will be looking or continually monitoring this provincial mask recommendation on a regular basis. Is that correct?
That is correct. And even today, I'm also an occupational health physician with Alberta Health Services. And so we were looking at masking, because now you hear about double masking, and what about N95 masks, and how do you make them, do you have to put one on top of the other, or just keep with these masks? So there's always ongoing reviews. And there's, even in Alberta Health Services, there's an entire scientific advisory group that reviews this. And then, of course, there are national groups as well. In addition, they are reviewing with these variants of concern. What does that look like with our current masking when they are more highly infectious?
And that's provincial-wide, including Lethbridge, where all of this is looked into by the experts, correct?
Absolutely. I'm at all those meetings as well.
Thank you so much, Dr. Sator.
Mr. Henley, I have a question for you. We passed the mandatory mask bylaw back in August for all, that was all inclusive of the whole community. And at that time, the province didn't have theirs in. So was it only our bylaw officers could that enforce it, or could peace officers or Lethbridge Police Service also enforce it at that time?
Councillor Parker, peace officers and bylaw officers and police officers all have the lawful authority to enforce that bylaw. The primary point of contact for the education piece on the bylaw, identifying compliance requirements within the bylaw, really fell and primarily falls to our department on the education piece.
Thank you. And my follow-up to that is, if this bylaw expired and the provincial one guidelines and legislation was still in place, or order, I should say, would our bylaw officers also be still enforcing it as well, just like they did prior?
To answer that question, we don't have the in-house bylaw officers, myself and the bylaw officers that work directly in City Hall. We don't have provincial appointments. The peace officers, I don't know if they would, because their appointments is quite specific. The police department would. I would anticipate, just like smoking legislation, that our department would still be the primary department that would educate on the provincial regulations. There's been it's difficult to separate enforcement agencies from policing and Alberta Health and bylaw officers to all of these COVID regulations. So every department has kind of worked together to try and help fill gaps where they can. Whether you're a public health officer, occupational health and safety officer, police officer, peace officer, or bylaw officer. But we could not enforce, we couldn't write a ticket for the provincial legislation, but certainly we have a comprehensive understanding of that legislation, and certainly we'd be willing to educate and answer questions on it, no different than we're doing right now.
So I just want to make sure I heard you loud and clear there, especially that last point. If it was just a bylaw, or if it was just provincial order, you don't have jurisdiction. Am I correct when you said that, to write up a ticket? Am I correct?
That's correct. But understand that the enforcement piece of this is everybody's focusing on ticketing. And the reason this has been successful, and it has been successful, really has been the education component that has been paramount all the way through, from our bylaw to the provincial regulation, masking, and as was identified earlier, this is one piece, and the key is that no one piece should overtake the other piece. They're all part and parcel.
Thank you, Mr. Henley. Councillor Campbell?
Yeah, still with Mr. Henley. Do you have a number of tickets that have been issued with the bylaw enforcement people
Yes.
relating to the bylaws?
We have not issued a ticket. I visited multiple tens of businesses, right? And spoken to more people than I can count, really. But we haven't had to be in a position to issue a violation.
Thank you.
When we talk about warnings, I'm not going to use that terminology either. I'll use a lawful direction. And a lawful direction is certainly something that we provide on a regular basis.
Thank you.
And that's both to business owners and individuals.
Is that your questions, Councillor Campbell?
Yeah, thank you.
No problem. Acting Mayor Higgin?
Thank you, and I appreciate that response. Regarding the education side of things, which I agree, that's the most important thing, and that's why we came up with this, and that was around the discussion with council throughout that time, is that educating is the most important part of this bylaw. And is it your opinion that Mr. Huntley, that this has been followed, the education? I think I'd heard that there hasn't been any tickets, but you have been able to converse with these individuals that may have been contravening this bylaw and educated them, and they continued with the proper protocol after those conversations. Would that be correct?
I think that's a very accurate statement on a general basis. And what I mean by general basis, business related. It's tough in a retail setting to have one person walk in and then they're gone, and they're long gone before a bylaw officer may get a chance to talk to them. But where it's been successful is communicating with the managers and the staff that are having to address the individuals coming in. And the key component really is this bylaw and the provincial regulation aren't intended to create conflict, either verbal or physical conflict in our community. It really is just a matter of trying to see an increase in the people wearing masks in public spaces, and I think the combination of the bylaw and the provincial enactment and all the messaging that's gone around with it has certainly seen a definite increase in the number of people wearing masks in public spaces.
Great. Thank you very much, Mr. Henley. Appreciate all you do to educate the citizens here in Lethbridge. Thank you.
My question is for Mr. Harper. So, Mr. Harper, it is the recommendation of the corporation administration, am I correct in this, that this be extended to December 31st of this year? Is that a recommendation of the administration?
That is correct, Councillor Parker.
Why wasn't, and I appreciate the answer, and it's up to us from the political values to agree or disagree, of course. Why was that month picked? Maybe you did answer this, versus, let's say, June 30th or March. Why was that date picked?
It was a couple different reasons. One, as I mentioned earlier, the immunization program isn't scheduled to be anywhere near finished until at least fall, and that was before the delays in the supply came out. As well, with the introduction of the variants, which are more contagious, we felt that it would be a safe date to put at the end of the year. Hopefully by the end of the year, the vast majority of the population would be immunized by that time, and the variants would be better understood and under control.
Thank you. My question for Dr. Sudort. Are you there? Can you hear me okay?
Yes, perfectly. Thanks.
And I don't want to put you in a political position, because you're not in a political position. You should be very happy for that. And is the province looking, as this is going to be from the vibe, and you can say, you know what, I don't know, is the feel that this is going to be a long-term play, that being the mask bylaw or mask order? Is it going to be like this is going to be around for a while feel within the provincial government, or is it just a week-by-week kind of analysis?
So in general, I don't think I can answer that question. There's a reason why I stay with my head on the ground.
And I appreciate that.
But I do think, though, that part of the overall strategies, and even occupational health strategies to protect workers, is to ensure that the workers have their, right? We have patients in hospitals who aren't wearing a mask, right? They're inpatients, they don't wear a mask for many reasons. They're sick in the hospital. So our staff have to ensure that they're fully protected. And so the protection of healthcare workers. So again, we have the one side, let's say public is not the masked, yet workers have to be fully protected in order to protect our workforce as well. So so we also work from Alberta Health Services public health perspective with all of our employers to make sure that they have measures in place, or if they have questions, that I know there's a Biz Connect and there's a lot of support provincially as well. But we also look at and review all measures in locations of employment to make sure that there's minimal transmission. And again, masking is one of those. I personally don't see, I think as what we're discussing, if masking is suddenly going to stop in a week or two when we are starting this journey of variants.
Yeah, and I appreciate that. So what you're saying, and I just didn't know if you had a feel like, kind of like, I think this is gonna be around for a long time, and I can appreciate that answer. So we're just trying, this is all new territory for everyone, and I know I can't imagine what it's like going through your guys' minds during this time. So thank you for that. Councillor Campbell?
Thank you. I guess this is for administration. What kind of communication is there between yourselves and Alberta Health Services and the provincial government? Do you share information? Do you talk about what's happening? The variants and things that they might recommend, or are we kind of here saying here's what we should do? What kind of communications do you have?
Councillor Campbell, yes, this is Greg Adair. Yeah, we certainly we have town halls on a weekly basis with Dr. Hinshaw, and we have those discussions and we bring forth those questions on a regular basis, trying to be part of the overall plan to make sure that we can take care of our citizens and our community as safe as possible. So that work continues on an annual basis. Further to that, we have and it's a very good tool, Biz Connect, where we reach out to them and ask those sorts of questions and seek that feedback from them. So we have a constant communication stream going between Alberta Health Services and the City of Lethbridge.
So you get a sense of where we're all headed, I would assume.
We certainly we try to keep ourselves aware of everything that's going on and the information that they can share. Yes, we try to keep connected as best as we can.
Thank you.
Acting Mayor Hagan.
Thank you, Chair. Question I believe would be for Mr. Harper, or it could be for Mr. Adair. I'm not sure who could answer this question, but hearing what we did just earlier about the constant communication daily with the Alberta Health Services when it comes to masking, how things are changing, and reviewing it on a almost daily basis by the sounds of it, could you share with me what the experts that you have spoken with to come to the conclusion of the end of this year?
Sure. So as we sat down as a group and an organization to try to determine what would be the best end date or the best date to put this bylaw out till, what we do recognize, it's all about safety, and safety is changing. And Mr. Harper had talked about the variants and the vaccination that we're optimistic and hopeful will be rolled out by the fall of this year. Fingers crossed, we recognize that by putting this date out till the end of the year, we're hopeful and optimistic that if things go as planned, we could look at adjusting that at any given time and removing it should we need to. So by saying December 31st of 2021 doesn't mean that we have to continue until that date. But what it does allow us all to is have that time to understand what is going on, any of the changes, certainly as we learn more about the variant, to give us that time to evaluate that and move accordingly. We also know that there's a council election coming up later this year, and we wanted to ensure that we could keep this bylaw in place until that election was over should we need it, so that we wouldn't have to be coming back to council right in the middle of a big election with an event such as this. So we thought that the end of the year would make the most sense. Again, remembering that as more information comes, we could look at adjusting that date at any given time, and if all goes according to plan, perhaps canceling that with the vaccination, should we have the success that we hope for.
Thank you, Mr. Adair. And I do see, obviously not just in our municipality, but in the fall, there will be elections throughout all of Alberta. And I would hope that the province is obviously looking through health guidelines for that and how they would navigate through that. So I guess the municipal decision it comes, you know, we've made this decision as a municipality and not one particularly recommended by Alberta Health, but just one that we're doing in a municipality. Is that correct?
That is correct, yes.
Great. Thank you.
Councillor Campbell?
Thank you. Thanks for reminding me about the election. I'd forgotten. But I just, was there consideration, and you know, with your contacts and maybe even Dr. Suttrup can chime in on this, is there realistic benchmarks that you could say we've reached this amount, or we're at this, we've gone to this level for this amount of time, therefore it makes sense we can, you know, do away with the bylaw? Is that in the consideration? I mean, you sort of alluded if things go well, we could change the bylaw, but in advance of that, could there be benchmarks that we could shoot for, that so that people can say, well, all right, here we're at, looks like we're doing well. I don't know, but just sort of thinking off the top of my head.
Yeah, and Alberta Health Services has done a really good job at putting some of those benchmarks out in place when they talk about, I guess, the next phases of reopening things. We do not have a plan where we would say if we had this many hospitalizations, if it's down to 100 for 3 weeks, we would look at removing that. But what we are doing is working with Alberta Health Services, like I said, on that weekly basis to communicate, and we would adjust if we started to see those trends and started to, as we consult with Alberta Health Services, if we started to see those trends continually moving downwards and stabilizing, we would look at readjusting that.
Great, thank you.
Yeah, it's Vivian here, Dr. Suttrup. Just I can add to that. So again, it's interesting, even from my observations, benchmarks, when do we increase measures, when do we relax on some of our multiple strategies that we have, even opening gyms and these kinds of things, and increasing our social group tolerances. So all those things are based on a number of different variables, and now those are being based on hospitalizations. And I would say right now we have half the number of hospitalizations in Lethbridge alone compared to Edmonton, all of Edmonton and their 1 million people. So we are still at high numbers. And I think all those measures, when we're relaxing things at provincial level, are still taking into account people stay home when they're sick, they're getting tested, there's social distancing, right? There's masking. So all these measures are being relaxed slowly, and then we try to see what happens. And then the next measure is relaxed to see then the delay. Why 3 weeks? My understanding of that delay is because there is a delay before people need hospitalization. So we may see increased case numbers, but again, that flattening the curve for those who have most severe illness or at most risk.
Can I just out and flat ask you, Dr. Suttrup, do you like the idea of masks until the end of December? I guess I'm being political.
That would be.
Are you being political?
And I think that might be a tough question to answer, but it's.
Yeah,
and
I just
yeah. I just don't want to put. I don't want to put our professional on the record on something like that, and I think that she's probably been advised not to as well. Am I correct?
Yeah, well, I've not been advised. I advise myself, I guess, but I can't answer that question because it really is going to depend whether I like it or not. A lot of these things we don't like. We can't travel. I don't like my kids complaining all the time they can't see their friends. Like, there's a lot of things we don't like, but it's a thing that we have to do right now to get us through this pandemic. As Dr. Hinshaw says, we're all in this together. And so I have no idea nobody knows what this is going to look like in 2 months, and let alone by December. So I can't answer that question. And I think we have to go as why those great connections, and I'm on a lot of those meetings as well, those weekly meetings with municipalities, just to hear those updates and see where we're at.
I appreciate, yeah. I'm sorry to throw that at you, but I thought I'd give it a shot.
further questions? Robin, Mr. Harper, did you want to add to that, or?
Yeah, I'd just like to mention something further to the discussion around the provincial thresholds, et cetera. The province makes decisions based on the province as a whole. That doesn't take into account any variations as far as various municipalities or communities. So I think that's something we need to keep in mind, that and we're seeing it now, as mentioned by Dr. Sutarp. Our numbers in Lethbridge here currently have started to see an increase again, whereas in other areas, other municipalities, they're starting to decrease. So we have to keep that in mind when we start thinking about this, is that we have to look at our municipality, whereas the province looks at it on a provincial-wide basis.
Thank you, Mr. Harper, for adding to that. Any further questions from members of this SPC to Mr. Harper this time? Thank you, Mr. Harper. I have the following resolution signed by Councillor Acting Mayor Higgin, Bylaw 6239, Temporary Mandatory Face Coverings Bylaw 4.1. Be resolved that the Community Safety Standing Committee receive this presentation, and thank Mr. Harper.
Yes, thank you very much, and for all of the input, Dr. Sutarp, and for all the others that have participated in this. I thank you very much for the comments, questions answered, etc. So with that, I'll call for the vote.
All those in favor? Opposed? And I do believe you folks are still going to be around just to answer questions if questions do come out in regards to some other presentations if provided. Are you okay? Dr. Sutarp, are you okay with that as well, Sutarp? Are you okay just sticking around for a bit? I know you're probably under some time crunch, so I just want to make sure we're respectful of your time.
Yeah, I have till 3 marked off, if that's okay.
Okay, thank you, and we'll make sure. Thank you very much. The committee has received a number of written submissions already. They have been circulated to the committee members and will be considered as part of the record. We will now invite anyone who wishes to speak about this item to come forward one at a time. As a reminder, you will be limited to 5 minutes. If you have a written submission, please leave it at the presenter's table and will be added to the public agenda afterwards. And once again, we will be wiping down after each speaker. Please identify yourself. Thank you. Is there anyone who would like to make a presentation at this time, either in person or through telecom or through Teams? Deputy City Clerk, do you have anyone?
We do not. There were 2 people that, when they made their submission, said they wished to speak, but neither of them are present.
Very good. For a second time? And there is no one in the lobby, and then there's no one in the gallery as well. Very good. May I have a motion to accept all written and oral submissions as information and debate? All in favor, opposed? So is there any, can I get a motion to accept the submissions as presented to date? Councillor Higgin?
Make that.
Or Councillor Campbell? Councillor Campbell? So a motion to accept all the information as presented, both written and as well. Thank you. All, any debate? All those in favor? The committee will now consider what they wish to recommend to City Council. So we have some, so this is kind of a round the table open discussion, or do you guys want a quick 5-minute break and then come back, or do you want to keep on going? Are you okay, everyone going? Everyone okay?
Yeah, I think we should keep going.
Okay, sounds good. So we have some options here. I have option number 1, and more options can be added. I'm just going to wait for Mr. Sarsfield to come back here, just in case we have to make some amendments here. And once again, this meeting is live to the public, and I do believe that it is going to be recorded, so if citizens want to, if they couldn't participate or watch in today's meetings, they'll have an opportunity to watch the presentation via YouTube or through the City of Lethbridge website. And we're just waiting for Mr. Sarsfield. So now we're going to go through the options and recommendations that we as an SPC will be making to City Council for the February 23rd meeting. I'm just going to read out the options, and then if I have an option brought forward and signed off, we will debate and discuss it. But option number 1 is the following. Be it resolved that the Community Safety Standing Committee recommend that City Council extend bylaw 6239, the temporary mandatory face coverings bylaw, to December 31st, 2021. That's option number 1. Option number 2, be it resolved that the Community Safety Standing Committee recommend that City Council extend 62339 temporary mandatory face bylaw December 31st with following amendments. So it's pretty much the same thing, but this one would be with amendments if someone wanted to bring that forward. Option number 3, be it resolved that the Community Safety Standing Committee recommend that City Council allow bylaw 6239 temporary mandatory face bylaw to expire. So now, is there anyone else from the committee that has another option that they would like brought forward, or would they like an amendment to the options that have been presented to us right now? Is there any questions on any of these recommendations or options in front of us at this time? Acting Mayor Higgin?
I just have a recommendation, so I don't know if that's...
Before we do that, I'll just see if there's anyone else that has something they'd like to bring. Councillor Campbell?
Oh, sorry, I was just going to make my choice and as number 2 with an amendment.
Okay, so what I'll do is I'll do it in the order of how they're received here. Do you have something signed off, Mr. No, so we have nothing right now. So why don't we deal with option number 2 right now? Is that fine, Councillor Higgin? Sure. So I'll read number 2, and you please tell me your amendment, and I'll have our city clerk write it down so we all know what we're seeing and what we're hearing. Sound fair? Be it resolved that the Community Safety Standing Committee recommend that City Council extend bylaw 6239, temporary mandatory face coverings bylaw, to December 31st, 2021 with the following amendments. Councillor Campbell?
Well, I don't really know how to wordsmith this particularly, but I just if we can include somehow, based on the all of our communication with the Alberta Health Services, just giving us the opportunity. I don't know how to really say this. Give us an opportunity to cancel the bylaw in the event that things turn around. If there's a way to say that. Because I would like to have a little bit of hope for people who are very frustrated with the mandatory face coverings. But I like to let people know that we're doing this because of science and because of what is happening in our province, and that in order, I just don't want to change it up all the time. So I don't know. Does that make sense, Mr. Sarsfield?
So can I maybe, tell me if I'm wrong here, you would like our bylaw to be parallel timing to the provincial order? Is that something you would want?
I think it would go hand in hand. Yeah, there would be that would make sense to me, that we should follow what provincial guides are suggesting.
Very good. So my question to Mr. Harper then to that. Now let's just make sure we first got it writing. Let's first make sure we encapsulated what you wanted to say, and when you can possibly see it on the screen, and you can tell us if we've captured your thoughts, or rather the city clerk has captured your thoughts. Okay, so do we have something yet? Not yet. Just give us a few seconds, sir.
I guess if things got better, but again, I don't want to use benchmarks. I just wanted, and I don't know what the definition of it when it gets better, when it's deemed unnecessary for mandatory face masks given the data that we have. So yeah, I don't know. Maybe I'm
so how is it fair? How about is it fair that our bylaw, so December 31st with the following amendments, that the City of Lethbridge bylaw 6239 parallel the guidelines and the order of the provincial Alberta Health. Does that sound fair?
I'd also like to make it clear that the number of cases that we have in Lethbridge specifically are at a level that we feel comfortable about based on the important, the medical officers that say, yes, that does make sense for us to do that.
Yeah, it's Vivian here. I know I'm not voting member, but maybe aligns with provincial directives, because that provincial directive even earlier has made specific directives for, let's say, Calgary, Edmonton, or parts thereof, as opposed to rest of the province. So if utilizing the word align with provincial directives, that may capture that.
That would, sure, thank you.
Perfect. And thank you for your input there. Councillor Hagan?
Is this debate?
Well, let's first make sure let's make sure we first have it in writing and we can all see it, so we're all debating and questioning the right motive and the right perspective which is being presented here. And Mr. Sarge, I can't see that far. I guess I'm getting a little older. You can't read. Maybe you can read it from your screen there that you just typed in. This is how it is written. This is the amendment.
So as the amendment is, and further that the bylaw be reviewed once there is a change. Oh, whoops, that's the wrong one. Sorry. And further that the bylaw be reviewed so as to be aligned with any changes in provincial directives on masking. Is that clear?
That would be, I think that makes sense. Mr. Harper, does that make sense to you? Is that, or
yeah, I would make sure that the wording is such that you're not making a statement that the municipal bylaw expires at the same time as the provincial mandate does, because that does not take into consideration any variances or individual municipality consideration. So if you align it completely with the dates of the provincial one, you may run into a situation where, yeah, everywhere else is good.
Yeah.
The province decides to rescind it, but Lethbridge is maybe not quite so good, and it might be a good idea to maintain it here. I would make sure the wording is such that I like the wording of reviewed,
right,
rather than specific alignment with dates, etc.
In alignment with provincial standards and also Lethbridge standards, if there's such a thing as Lethbridge standards or Lethbridge, I don't know what the word is.
How about the Lethbridge?
First of all, thank you, Dr. Sotorp, for your recommendation, your wording on that. That's greatly appreciated on behalf of the committee. Thank you for that.
So I have some more wording, and if it's agreeable, then we'll type it up.
Okay.
So, and further, the bylaw be reviewed so as to continually aligned with the provincial directives on masking and the Lethbridge situation.
That sort of says what I'm trying to say.
I wonder, sorry, again, I don't know if I'm supposed to interject here.
No, please do, please do.
Yeah, it's also local transmission, because Lethbridge, again, is a hub for many surrounding communities for shopping and for all that. So I respect this is city council, but you're providing services and access to a lot of things for other surrounding communities. So maybe local transmission.
Okay.
Or local incident rates, or whatever you want to call.
Okay.
So, Mr. Harper, if this amendment was to be accepted, and this was, so what does that date of December 31st, 2021 mean to you, or how is it interpreted if this was to be passed, from your perspective?
From my perspective, if the date remained, if there were no changes, the bylaw would continue until that date. However, at any time, if there was a change in directive of the province before that, we would have the opportunity, or council would have the opportunity to review that and make a decision whether to continue to that date or to change it.
Thank you.
That's exactly, I mean, I want to go with the science, and I want to go with what is happening in Lethbridge specifically, superseded by what the provincial government is saying as well. So, but I think that gives the sense of what I'm trying to say in that wording.
So we got it in front of us now. Do we have questions on the amendment? Councillor or Acting Mayor Higgin? This is debate. So is there any questions in regards to the amendment on option number 2 that was presented by Councillor Campbell? Seeing none, we'll now get into debate on option number 2 with the amendment, okay, as amended. So Councillor Campbell, would you like to open up?
Well, I feel that the you know, and based on a lot of the feedback that we've gotten, I feel that December 31st is harsh and hard to understand or hard to accept, but we keep it in there until we find out that in the province we're getting you know, everyone's getting immunized. We're dealing with the variant. Things in Lethbridge are turning around, and we see an absolute trend based on what the people are telling us, what you know, the medical community is telling us, that we can go back and say, okay, we're in a good shape. Let's discontinue mandatory face masks. That's where I'm getting to with this. So that's my hope for what I'm trying to get across here.
Thank you.
And to give some hope to people that say, well, December 31st, you're crazy. Well, you know, if we have to go till December 31st because numbers have spiked to 250 in November, that's the way it is. If they're not, and we're over it, fantastic. So I just want to have an opt-out clause.
Thank you, Councillor Campbell. Debate here. I know, Councillor Merle, you're on the phone, so if you do want to dial in or just say, please let it be noted. But right now I have Acting Mayor Higgin.
Thank you, Mr. Chair. I looked through this, and this option 2, with the way that we've discussed it, is pretty much option 3. And I say that because I'm going with advice of an expert, and I've just heard from an expert that says that they continually monitor Lethbridge on a practically daily basis and know if our hospital system is overloaded. To have a municipality be the one to set this, I'm concerned. I am more to listening to the experts on this, and I think that they will put in place, if we are needing masks for longer, we'll hear it from the province. If it's almost like a sunset clause, they'll figure this out. They'll know if our southern Alberta or Lethbridge in particular is needing to remain masked. We'll hear that. And so from the information that I received today and the comments from an expert, I'm more confident in an option 3. So for option 2, I will not be supporting.
Can I just see option 3? I'm sorry, I need to see what option 3 is.
Okay, if you don't have it in front of you here, and so yeah. We've had you open. We had Councillor Acting Mayor Higgins speak. You have a question regarding option 3. So before we get into further debate, I'll just read it out to what option 3 is. Be it resolved that the Community Safety Standing Committee policy recommend that City Council allow bylaw 6239, the temporary mandatory face coverings bylaw, to expire. That means it will expire on the 23rd of this month. But that's just, we're just talking, we're speaking on this one right now, but I just wanted to make sure you got,
okay.
And I think you have a hard copy, you don't have a hard copy, but you do have one in your package as well. Okay.
I just wanted to see it side by side, and I stand by my option 2.
Thank you. Further debate? This is how I look at this. This is almost like a compromise resolution. When I asked the question to Mr. Henley, he said if we didn't have the bylaw in place, we as a community don't have an ability to enforce. And that was never the idea. And he stated off the bat, we don't really want to enforce, but if we don't have a bylaw in place that's in line following what the province is doing, really we are defenseless and we have no way of enforcement. And I hope we never have to go that way. I take this, and after hearing what Mr. Harper has stated, that if the province, as soon as the province, if this is in line and how it's taken, if the province suddenly says in 2 months, you know, we're on the home stretch and all that, masks can come off, that means that we would then follow up with the following resolution at our next council meeting that we would rescind ours because we would be in line with the province. And I think that's what we want to do. I think if we went to option 3, it doesn't show that we're in line with the province, even though the province has it in there, but we want to show that our values of health and safety are in line with the province. And I think that's more in line with option 2 with the amendments. Councillor Morrow, do you have anything to add?
No, I don't. Thank you, Mr. Chair.
Perfect. So we're going to vote on option 2 with the amendments. And once again, this is a recommendation to council. So, and then it's up to council to then ratify or change it or do whatever they want with this. So we're just doing what was asked of us by council. I'll call the question, or I'll let you wind up, Councillor Campbell.
Yeah, I mean,
I'm just gonna have it read out loud one more time so we know exactly what we're discussing. So go ahead.
Okay.
I can't see it, like it's okay, I can read it now. Option number 2 with the amendments. Be it resolved that the Community Safety Standing Policy Committee recommend that City Council extend bylaw 6239, temporary mandatory face coverings bylaw, to December 31st, 2021 with the following amendments. Further be resolved that bylaw 6239 be reviewed so it is continually in line with the provincial directives as it pertains to the City of Lethbridge local transmission levels.
right. So, you know, I basically want to have an opt-out clause is what for me that's what this says, so that you know, when things turn around and we have the science and we see that the numbers are down and they're consistently down, then we can revisit this and say, all right, no longer do we need mandatory mask coverings. But because we're still in the pandemic, because we're still dealing with the variants, we need to maintain our mask bylaw right now. So this gives us both the safety that we require at this time, but also looks forward to the point where we're going to deal with it being over and done with. So with that, I ask for your support. And again, it has to go to City Council for the debate as well. So that's, I ask for your support on that.
Thank you. So the question's been called. Option number 2 with amendments. All those in favor? A roll call, Mr. Sure. Thank you.
So this is on option 2 as described.
With amendments, yeah.
With amendments. So Councillor Campbell?
In favor?
Councillor Morrow?
Opposed.
Councillor Parco?
Favor?
Councillor Higgin?
Opposed.
So that's defeated 2-2. So option number 2 with amendments. Thank you, Councillor Campbell, for bringing that forward, and good conversation. And I think we have a resolution signed by Councillor Higgin on option number 3. Am I correct? Very good. Be it resolved that the Community Safety Standing Policy Committee recommend that City Council allow bylaw 6239, temporary mandatory face bylaw to expire. First of all, any questions in regards to option 3? Question, or is that? Yeah, go ahead, Acting Mayor Higgin.
Question for Mr. Harper, or actually probably for, I don't know if he's still on here, Mr. Henley? I do see his name on here. Are you there, Mr. Henley?
My mic can stay on.
Okay.
Yes, I am.
Thank you, Mr. Henley. A question I have is if this particular temporary mask or temporary mandatory mask face coverings bylaw expired, if this was taken through to council, and I know that we haven't passed out any tickets from what I understand, if I hear correctly, and education was the major point of that. Will you stop education if this happened?
No, Well, I indicated that before. Certainly, um, it is a group effort for all of these COVID restrictions. So whether it's provincial order or municipal order on masking, hand washing, distancing, using the parks, they all fit together. So certain, I would certainly be willing to field calls and answer calls on the provincial regulation. I couldn't.
Thank you very much, Mr. Oh, sorry, go ahead.
I would have to follow the police department.
Yeah. Thank you very much, Mr. Hanley. That's a question I have.
Any other questions on option number 3? Very good. Seeing no questions. Would you like to open up debate on number 3?
Thank you, Mr. Chair. I think in light of some of the conversations we've had today, we see that the situation with COVID in our community has been monitored on a regular basis. And I know sometimes when we think the province, we're thinking Calgary and Edmonton, and I think so often we think that. But Dr. Satorp obviously has commented that this is looked at on a daily basis. And there's conversations back and forth with Dr. Hinshaw, the Chief Medical Officer of Health, regarding what is going on throughout our community. And I believe that the experts will make the right choice. And so I would just like to follow what the provincial guidelines have set out. And I do want to add that I'm happy that the education will still continue. And I think that's what was one of the concerns practically or partially in option 2. And so for that reason, I would ask for council support.
Thank you. When we voted on this originally back in August of this last year, the provincial government had nothing in place in regards to mandatory masking. And at that time, I voted against it for the reason being that I felt, and I still feel that way, it is not the city's mandate in regards to telling people what to do in their place of private business, and I lost that, and I also respect the decision of my colleagues as well. And not once, and have I ever said that I don't believe in masking. I believe that you should always be an expert at listening to the experts. But at that time, the experts being Alberta Health did not come out with the mandatory guidelines in place. So it ended up actually working out okay for us. And sometimes maybe you're not on the right side of it in regards to maybe the mask worked out really good. But I'm glad, and I do believe that in early December that the province did make it mandatory. And when I say glad, I'm glad because it takes the burden off municipalities having to make these kind of decisions. And that was very important, and I'm glad that Alberta Health made that decision. For us to have a bylaw, and I debated in option number 2, it's almost, it sends a mixed message to the community. And some would say depends how you look at that, but is it redundant? Let's say it comes to a point where the province does remove it and we still have a bylaw in, or it could cause confusion, it cause mixed messaging. And I think each and every week is different. As we know, the numbers are all over the place, and the trend was going in a good way for quite a while, but the numbers have been a little more higher in our region lately, and we've seen that through news reports and all that, but I'm optimistic that numbers will come down. But I think that the province has good guidelines in place right now. I believe that they will make the right decision. Did I prefer option 2? Yes, but I also believe that this is going to be around for a while and that we should follow the guidelines of the province. And when the province does decide, if the province does decide to pull the mask bylaw, and I remind you this, council does have the right to bring another bylaw in if they see fit at that time. So for that reason, I will support option number 3. Any other debate or discussion? Seeing none, would you like to wind up, Councillor Acting Mayor Hagan? I apologize. I just
one. Sorry, I just had.
No,
one,
please go ahead, Councillor Campbell.
I just want one quick thought. I just, it's like my reason for number 2 is just I want it to be very local focused, because what happens in our community is based on what has to happen here. And I know, mostly it's a provincial thing, but I think we have to really follow what's going on in Lethbridge, and therefore I don't want to have to change the bylaw again if things are going the opposite way. So I still prefer the number 2, and I won't be supporting number 3.
Thank you, Councillor Campbell. Councillor Hagan, would you like to wind up?
Thank you. I won't be long, but I just want to state that, of course, the province has come out with this mandatory mask covering, and for that reason, it's them that deal with health. It's Alberta Health. It's not Lethbridge Health. I know that we need to follow direction from the province. Again, I can't reiterate enough. I was happy to hear that on a daily basis, and I'm sure I knew this prior, but it was good to have it confirmed that on a daily basis, they're monitoring Lethbridge. So they're making sure the health and wellness of the citizens here in Lethbridge. If we have any concerns, we can be in touch with Alberta Health, but and we do on a weekly basis. We do meet, as we've heard from our administration, on a weekly basis, and they can express the concerns if they don't find that this particular masking done at a provincial level is a concern to the community. They will make sure that they know that, and so I would ask for council support with option number 3.
Question's been called on option number 3. All those in favor, roll call, please.
Councillor Morrow,
Favor.
Councillor Parker,
Favor.
Councillor Higgin,
In favor.
Councillor Campbell.
Oppose.
So that carries, but when it carries, now is this going to go to City Council as a recommendation? It is up to City Council to decide what they want to do with this recommendation. So this isn't set in stone in any way. This is just, we did our work on behalf of the recommendation of council, and this is something we're bringing to our council for the February 23rd meeting. So nothing more, nothing less. I want to thank Dr. Vivian Sudorp for being here, answering our questions, and I greatly appreciate all the work you do in our community, not only today, but on each and every day, and all the staff at Alberta Health. So please extend our thank you to you and your team. I also want to thank all the people that have submitted in writing, by also an email. I want to thank our presenters and the staff that helped answer any questions. It's greatly appreciated. Seeing no other, can I get a motion that we now adjourn this meeting of SPC? Acting Mayor Higgin?
I'll do that, sure.
Motion to adjourn. All those in favor? I don't think we need a roll call. Perfect. Thank you very much, everyone.
Thanks, everybody. Thanks for the talk.
Thanks, everyone.